Hello. It's great to be here during 29 Days of Heart campaign, and I'm really excited. I'm Selena Gore, the CEO of Women Heart, and Women Heart is a national patient-centered organization. We provide support, education, and advocacy for women living with or at risk of heart disease. And as many of you know, as most of you know, February is both Heart Month and Black History Month. And at Women Heart, that means that we have our annual 29 Days of Heart campaign, which really seeks to uplift the voices of Black women with heart disease and to shine a spotlight on the health inequities that exist for Black women, as well as to provide empowering and motivating information about how one can take control of your heart health. So part of this campaign is an invitation to our partner organizations to join us in this effort and to add their name to the campaign to share the messages with their audiences. And you can see we have a full list of partners on our campaign page at womenheart.org/29 Days of Heart. And this year, we're so thrilled that some of those partner organizations can join us live on social media to tell us about what their organizations are up to. So today, I'm so delighted to have Dr. Rachel Bond here with us, representing the Association of Black Cardiologists. Dr. Bond is a board-certified attending cardiologist and the system director of women's heart health at Dignity Health in Chandler, Arizona. And we just talked about it. It's where the Super Bowl is this weekend. And we are so proud to have Dignity as a member of Women Heart's National Hospital Alliance as well. Dr. Bond is also a 2022 Wenger Award winner for her excellence in medical advocacy. Thanks so much for being here, Dr. Bond. Can you please kick us off by telling us a little bit about the Association of Black Cardiologists and what its mission is?
Yes, and thank you so much, Selena, for that introduction and for even creating such an opportunity for us to get messaging out there, hearing patient stories, and also hearing from leading organizations like the Association of Black Cardiologists. So I'm very fortunate to be a part of the Association of Black Cardiologists. Just to explain the role of what I do in the association in terms of my volunteer work, I do co-chair the Cardiovascular Disease in Women and Children's Committee. I also sit on the board of directors for the Association of Black Cardiologists, but let's take it back to what actually ABC is, or the Association of Black Cardiologists. And we know that the mission behind this non-for-profit organization is to promote the prevention and treatment of cardiovascular disease, including stroke, in those that identify as Black people and other minorities, and to achieve health equity for all through the elimination of disparities. One way that we, particularly through the Cardiovascular Disease and Women and Children's Committee, have really taken on the lead in trying to do this for women in particular, is taking a stance in what we're seeing with the maternal health mortality rates, which we do know are disproportionately impacting Black women who are dying at rates that are 3 times that of their white counterparts. Not only are they dying, but they're also having near misses where they're almost passing away. And when we look at the statistics, we see that heart disease or cardiovascular disease as a whole is the leading driver of that. As such, the ABC is really putting it amongst themselves to get the messaging out there, provide education, advocacy, work on research strategies, and also work with organizations like Women Heart to hear the patient stories and get to the heart of the community to help to change these statistics.
Thank you so much, Dr. Bond. You know, ABC has always been such a great partner with Women Heart. We've done many things together, whether it's events on the Hill here in DC or events in the community. And while they are a membership organization representing doctors like yourselves, the mission and the work is so patient-centered. And I know that folks like you are driving that patient-centeredness, bringing patients to the center of these conversations. I mean, I know it's truly making a difference in lives of real people experiencing heart disease. I know that there are also various initiatives at ABC that you're driving, and that some of those have a really direct impact on Black women specifically. So I want to hear from you about the work that you all are doing on maternal health. I know that we partnered on that initiative. Can you talk a little bit about that work that you're leading, focus on Black women's maternal health, and maybe explain why an organization that is focused more generally on heart health is so active in this specific space of maternal health? What's the link there?
Absolutely. And I think it's a sentiment to the fact that when we think about maternal health, we know that there's an intersection between that and cardiovascular disease, which means that a lot of the conditions that may occur during one's pregnancy, if they decide to proceed with their pregnancy, may also impact their future cardiovascular health. These conditions include high blood pressure with pregnancy, preeclampsia, diabetes of pregnancy, having a premature labor, or having a child smaller than expected age. Those are actual risk factors independent of other more traditional risk factors that could actually linger on up to 20 years after that person actually had their delivery. With that in mind, and with hearing the statistics I mentioned, which are that Black women are dying at higher and higher rates from largely preventable causes. So all of the mortalities, when we think about it, that are from both cardiovascular disease as well as maternal health, are preventable nearly 80% of the time.
Wow.
We at the Association of Black Cardiologists wanted to get involved in terms of giving guidances to patients on here are the tools that hopefully could allow you to self-advocate for yourself. And most importantly, have you start those conversations with your clinicians, figuring out how to best track your numbers and get any of your risk factors ideally optimized. What we have done is the ability to do this is through our We Are the Faces of Black Maternal Health campaign. This campaign was initially launched last year in February of 2022 at the outskirts of Heart Month as well as Black History Month. Last year, we had an opportunity to hear from clinicians like myself to really highlight the fact that Black maternal health impacts everyone. You don't have to be a mother, you don't have to be Black even, and you don't even have to necessarily be a patient, possibly even a clinician like myself. It impacts all of us, but most importantly, all of us can help to mitigate these staggering statistics that we're seeing. This year, our campaign, which is now in phase 2 and was launched February 1st of 2023, is actually highlighting the voices of these women that may have experienced complications during their pregnancy. Today, even, the Association of Black Cardiologists released our first patient story on a nurse, former nurse named Maisha, who talked a little bit about her journey through her own pregnancy, which included having a diagnosis of preeclampsia and then eventually having that transition to a condition called peripartum cardiomyopathy, where the heart muscle becomes weakened. One thing that I think is so valuable with Maisha's story is that she really talks about the importance of how a key step to improving these outcomes is actually acknowledging Black mothers' concerns and listening to Black mothers. Even though she was in the healthcare system, even though she was a nurse, her providers didn't listen to her when she said something was going on. So that led to a delay in her diagnosis. And luckily, she had all the tools herself because she had a history and background in the medical field to say, something doesn't seem right. So listening to Maisha, it does tell you that this spans across sociodemographics, but most importantly, listening to Maisha talks about the fact that as women, we know our bodies better than anyone else. And if something doesn't feel right, it's absolutely important that you express that to your clinician and make sure that all of your concerns are being answered. And that's what our hope is with the We Are the Faces of Black Maternal Health campaign through the Association of Black Cardiologists.
Fantastic. And we've got a link there, right? We are the faces.abcardio.org. Is that right?
Yes.
When you can find that campaign. So thank you so much. I mean, that such good information and such a powerful sort of call to action to everyone to say, look, we are all affected and we can all take action. So I really encourage folks to find out more about that campaign. Women Heart has been proud to really engage in some of that work alongside you, and to do it actively in this space more broadly. I mean, in the last few years, For example, Women Hearts created a patient-centered infographic on heart disease and pregnancy. We've engaged in advocacy efforts for policies that support maternal health and heart health. And we have also really worked to raise awareness about the link between the two, as you've just so eloquently described. I know that this month, you like you said, you just launched the video today about your first patient story related to pregnancy and heart disease. Can you talk more specifically about what aspect of Maisha's story is the thing that really stuck in your mind when you think about like how others who might find themselves in that situation can go, I remember that story that Dr. Bond talked about, and this is the thing that has to drive me to be confident enough to insist that I'm feeling these symptoms.
Well, what I think is important to acknowledge is that women, and particularly Black women, are more prone to many of these adverse pregnancy outcomes, preeclampsia being one of them, where the blood pressure may be severely elevated and it may begin to impact other organs like the kidneys, the liver, the brain, the heart, most notably. And eventually, sometimes that preeclampsia can transition to a condition called peripartum cardiomyopathy, which is unfortunately the leading cause of why mothers during their pregnancies die. And we know that there is a high proportion of Black women who tend to have peripartum cardiomyopathy as opposed to their white female counterparts. One thing that Maisha's story highlights is that she knew that there was something going on. She knew that her shortness of breath wasn't just the run-of-the-mill pregnancy shortness of breath. And she knew, most importantly, that her blood pressure being elevated wasn't normal for her. And I think what she highlights is that when you are going into a pregnancy, it's important to understand what risk factors you may have and what those risk factors are that may predispose you to conditions like preeclampsia or possibly even peripartum cardiomyopathy. And if you have those risk factors and you understand the questions that you should be asking that clinician, our hope is that they will begin to listen to you. They'll work with you and figure out what is the best treatment for you and the best management for you. And of course, looping into the fact that we want to prevent these actual episodes from happening. The only way to do that is to, number one, make sure that the clinicians are educated about these particular conditions, something that the Association of Black Cardiologists is working on. But through Maisha's story, using her as an example, how much she had to self-advocate for herself. Exactly. And although that's not always ideal, there's absolutely nothing wrong with that. I really encourage every single patient out there to say, these are my risks. I know that because I have X number of risk factors, I'm more likely to have preeclampsia. I'm more likely to have gestational diabetes. What can we do to prevent that? How can I work with you to ensure that this doesn't happen to me? And if I feel something's not right, how are you as my clinician going to act on it? And I think hearing Maisha's story, how powerful it was, that's exactly what she did. And in doing that, she was able to navigate herself through sometimes a very complex healthcare system. And I think that definitely led to her having a positive result in the end, as you'll hear in her very powerful story.
Awesome. Now, I know that in addition to maternal health, there are other efforts at ABC that directly impact Black women. Can you talk about some of those exciting projects coming up?
Absolutely. So ABC, as you mentioned, at the core is a very community-focused organization, and they have a signature program, which is called the Spirit of the Heart Community Program. What this program does is it goes through several United States cities or cities in the United States, and they provide a leadership forum. So there could be patients out in the community who are getting trained on how to be part of a community advocacy program like the Spirit of the Heart Community Program. But we also provide health fairs where we provide complimentary screening on blood pressure, cholesterol, blood sugar, weight management. We provide a lot of education centered on that. And most importantly, we tend to incorporate a trusted community member, which many a times includes a faith-based member of the community. So we receive messaging from the pulpit, perhaps a local church. What we want to do with the Spirit of the Heart Community Program, which in the past has very much so focused on those that are the more classic age when you think about cardiovascular disease, is ensure that we expand it to the entire life course and the entire continuum of health. We know that as it stands, even when it comes to maternal health, if we optimize our health well before we are thinking about having a child, we're less likely to have complications when we decide to have that child. Because I am the co-chair of the Women and Children's Committee, children being an emphasis, I'm fortunate to have my co-chair who's a pediatric cardiologist. And with the Spirit of the Heart, we really want to encourage that these screenings start even in childhood, ensuring that we maintain those screenings through adolescence, and then most notably continue on the path of ensuring that people, particularly Black women who are dying at higher and higher rates prematurely from cardiovascular disease, even outside the scope of pregnancy, understand the importance of getting their numbers checked, but most importantly, the tools of what they can do to reduce these risk factors. So I'm really excited to see what the Spirit of the Heart does in the next coming year, and also collaborate with them on these initiatives.
That is fantastic. I love the idea that you are working on heart disease through the lifespan, and it's something that Women Heart is really also embracing as well. Now, before we wrap up, I want to ask you if you have any advice or motivating words for the women who are listening, who may be working hard to recognize their risk factors and to try to get them under control, whether it's blood pressure or cholesterol or diabetes or their weight, or maybe others who are working to manage heart disease more broadly, so that they can, remain active and thrive. So, as a cardiologist and as a woman, what would your advice or guidance be?
My advice and guidance would be absolutely at least once a year, go for your well woman visit. What that will include is checking those numbers, and most importantly, keep track of those numbers. See what your blood pressure is on that visit. If it's mildly elevated, continue to check it throughout the course of the year. Talk to your clinicians about what your goals should be. Everyone is different. Medicine is not a science, it's an art. So everybody has their own unique goals that they should reach for themselves. We also encourage everybody to live heart healthy. The easiest way to do that is to maintain a well-balanced diet, make sure you're exercising at least 30 minutes a day of some form of cardio. That could include walking, making sure you're getting out now that the weather, at least in my state of Arizona, is not boiling hot, but cooler. And most importantly, the other vital thing that I always tell women, particularly women, is that we tend to put the health of everyone else above our own. And it's important that we understand that self-care is a form of healthcare. And in order for us to care for our families, we have to care for ourselves, and included in that, I should say, is making sure that we're maintaining sleep. That can impact our psychosocial status in terms of stress, anxiety, and depression, which do disproportionately impact more women, especially women of color. So following these core steps, I do think is going to help at least start the conversations and hopefully prevent this glaring high rate of cardiovascular disease that we're seeing in our communities.
Thank you so much, Dr. Bond. I took some notes so that I myself need to follow these words of wisdom. It's always a pleasure to connect with you. We invite everyone who's been listening to learn more and to take action. Please visit womenheart.org/29 Days of Heart to learn more about our campaign. As well as in the comment section, you see ABC's campaign, wearethefaces.abcardio.org. Um, please spend some time educating yourself, learning about heart disease and heart disease in women, and know that there is always support and resources and verifiable information based on good evidence. So please visit us. I will be back again next week live on Tuesday afternoon with one of our Women Heart champions from Tennessee, Jaretta Utley. Thank you, everybody.
Thank you.